Hello to all those that are watching and joining us here today. Thank you. Before we dive into our topic of types of intervention for children with special needs, here is a brief introduction of who MindStory is. We are a special needs training center that provides services such as academic support, behavior therapy, clinical psychology, counseling, occupational therapy, reading therapy, as well as physiotherapy. So all of this covers services such as academic delays, sensory delays, developmental delays, behavioral and emotional difficulties, as well as physical delays. If you have any questions or you would like to talk to us and get to know about us more, feel free to contact us at MindStory. Here is our contact number. You can also contact us through our website or our email address. Without further ado, let's welcome Mr. Charlie.
Hi, good afternoon, everyone. Thank you for attending for our Facebook Live this afternoon. Good afternoon, Allyssa.
Good afternoon. Okay, so today we're going to be talking about different types of intervention for children with special needs.
Correct.
So when it comes to the different types of intervention for children with special needs, may I know how many types are there?
Okay. All right. Before I start, my name is Charlie. I'm the counselor for MindStory. So what I normally do is I talk to parents about types of intervention that are provided, as well as type of intervention available out there. Okay, so today, like what Alisa asked just now, a lot of parents also ask me. Actually, it's a lot of types of intervention depending what are you looking for. But from on the top of my head, I think there's about 7 or 8 types of intervention that is available for children with special needs. So the first one I would like to talk about, the first type of intervention, it's diagnosis. Okay, we provide normally clinical psycho. Normally in aspect of like MindStory here, we will have our clinical psychologists to do screening or assessment to determine if the child has certain special needs. Okay, and then from there they will recommend what to do next. So the first type of intervention will be providing diagnosis for the children as well as the follow-up. So a clinical psychologist normally will do that. We have our own in-house clinical psychologists. So they are registered and they are practicing in terms of as a clinical psychologist, and they provide diagnosis. So they screen types of special needs like autism, ADHD, as well as the developmental milestone, meaning that your child at certain age, there are certain things that they are supposed to do in terms of their development. So that's the first type of intervention that is known.
I see. Okay, so other than clinical psychologists, what about special needs teachers and stuff like that? What can they help with?
Correct. So that's a good one. So that will be, we move on to the second one, second type of intervention. So special need teacher, or other word, we call it as academic support. So these are the teachers that are trained or experienced in handling children with special needs. Why we need this kind of teacher is because a lot of teachers in terms of in kindergarten setting or primary school setting, the children need different types of in terms of delivering academic in different ways based on what the child is lacking of. So special need teachers is where they will support the children in terms of learning, not the traditional way, but how the child learns. So some child might be relying more on visual, okay, meaning that they see something faster than they listen. So this is where the teacher will come in. Teacher with experience with working with children with special needs will come in and provide a support. How do we help the children to learn based on their ability? Okay, so this is a very important intervention for children, especially those who are transitioning or moving into academic setting. As we know, children with special needs, they have different types of difficulty. So when it comes to academic, this is where we're going to talk about the intervention is more on academic support. So the teachers will come in and provide support for the children that have difficulty in learning. So basically, that's the second types of intervention.
So that's already the second one. Wow, it's very interesting. So other than that, what else do you have? What types of intervention do you have?
Okay, all right. So the third one will be occupational therapy. So occupational therapy, some parents will ask, "Oh, what is that?" Okay, like why do I need occupational therapy? So occupational therapy, this type of therapy is run by a therapist called occupational therapist. Okay, if you're looking for occupational therapy, please look at the therapist, the background of it. So most of them, or in fact, all of them who are practicing as an occupational therapist, they have to be registered in with the Malaysian Board of OT. Okay, what do they do for children with special needs? Normally, at the young age, is they have few components that they will look at. So the services included attention. When your child have difficulty paying attention, so they can tackle that issue. And then secondly is fine motor skills. So fine motor skills are related to like handwriting, uh, small tasks using finger strength. The child might have difficulty writing, so it's all related to fine motor skills. And then you have what they call a sensory. Okay, so when a child experience too much of a sensory, like maybe the lights are too bright, maybe the classroom setting, the students is a lot, the noise level is quite high, they cannot handle. So this is where occupational therapists will come in and provide intervention, like they will help the child to normalize with their situation so the child can cope with the senses, the five senses or seven senses around them, so they can make sense out of it. Because based on what I know from OT, when a child experience high level of sensory, they will they will tend to avoid. So when they avoid, they create a lot of behavior which is deemed not suitable in the classroom setting. For example, if the lights are too bright, the child will close the eyes or look away. Okay,
I cannot
some
focus.
correct. So it will affect their attention, or maybe the noise around the classroom setting is too loud, so the child tends to close their ears and then ignore the teacher. So in this kind of situation, some might think that the child is rude. Okay, why are you not replying to me? I'm calling your name. So maybe the voice or the the sound is too loud or beyond acceptable for that child. So this is where we will call it as a sensory difficulty, or they have difficulty uh, receiving the input. Okay, another one we look at sensory, and then you have cognitive skills. Okay, like frustration tolerance, turn taking, this kind of thing where the child have difficulty taking turns, or they refuse to share, or they cannot tolerate with frustration. So when they get angry, or when they get frustrated or not comfortable, they will react in the way they want, which is sometimes is not uh, applicable, or it's not adequate for the classroom setting or the normal setting. For example, if the child refuses to share, but the teachers or parents ask the child to share the item or remove it, then they start crying, kicking the floor. Um, it's very hard for them to calm down. This is where you can also look for occupational therapy. And then there's others as well, like the most common one we can see is hand and eye coordination. Okay, so some kids have difficulty copying
Yes.
whatever written on the in terms of like classroom setting. When teacher write on the board, the child has difficulty copying on the paper. So whatever they see on the board, they are unable to translate on the paper. So this is what we call a hand and eye coordination difficulties. Also bilateral, meaning both hand or both legs, you have difficulty. So for example, the child will be the strength on the dominant hand. Let's say my dominant hand is right hand is stronger than the left hand. So when I was given a task require both hands, and then the child will have difficulty. For example, cutting papers, one hand holding papers, one hand will be handling scissors. So if the child have a bilateral or both hand difficulties, then they will definitely have difficulties with cutting. So this kind of example is something that can be addressed through occupational therapy intervention. So that's why sometimes it can be quite confusing, even for some health professional, because occupational therapist is quite wide, quite broad, and normally they see it in terms of dealing with adults, adolescent, teenagers, or elderly people. When they experience medical condition like stroke, they are unable to walk or they cannot go back to work, so they require to go for occupational therapy to get back to the original state or to help them to improve the current difficulty so that they can go back to work. Hence the name occupational therapy. But for the child occupation start at young, is play. From play, they move to school settings. So this is where occupational will come in and help the child to adapt or move on from play to school. So basically, that's what occupational therapy intervention is about.
I see. I honestly didn't know there's so many things that an occupational therapy can cover, which is very interesting.
Mhm.
Okay, so other than that, what other types of intervention do you have for us?
Okay, so move on. This is quite related to occupational therapy. The following one will be physiotherapy. So physiotherapy is also almost similar. It's just that as occupational therapy, it's just that they are focusing more on gross motor or the big movement of the body. Okay, so similarly, like occupational therapy, a child reach certain age, there are certain activities or requirement for the child to achieve. For example, by the age of 3, your child able to walk, or by the age of 1 or 2, the child from crawling to walking before running. So it requires a lot of the big motor, big movement, jumping, balancing. Okay, most of the time we can see physiotherapists and occupational therapists work hand in hand in terms of dealing with the motor skill. This is what we call motor skill. Like for example, from walking, reaching out to take a pencil. Okay, you need a lot of muscles of doing it. So for physiotherapy, also often I have parents ask me like, why do doctors or clinical psychologists recommended physiotherapy? So as we speak, it address the big muscle or the big movement. Okay, so this is where your child need this kind of intervention. One of the example, parents like I have explain. I used to explain to parents, if your child has difficulty walking or sitting or carrying out exercise. Okay, so this one have may related to the big core muscle. Okay, we're talking about the trunk muscle, the leg muscle, the hand muscle. Sometimes it's not activated yet, or the child experiencing pain. Okay, we have certain cases where child experiencing pain on the knee, on the ankle, because of the standing posture, the sitting posture is not good. For example, W, you can see kids, they used to sit with the leg going backward, they bend the knees backward. Those kind of sitting posture is not good for the child. Okay, this is where the child have will have difficulty sitting, and then some will according to the doctors, they will say that the muscle is underdeveloped, meaning that it's not fully developed. So you need a physiotherapist to help you in terms of stretching to reduce pain or do some exercise to promote muscle activation. So in return, it will slowly improve in terms of their motor skills. Okay, because a lot of time from my experience working with parents, sometimes we are focusing so much on academic. We tend to leave these kind of things out, like in terms of the musculoskeletal function. Okay, so it's like we are so focusing so much on academic. Like I'm looking for teachers for tuition, but without realizing, my child cannot jump, my my kids cannot run properly. You can see a lot of children who with autism, they tend to gallop when they run. It's like a horse galloping, 1 2 1 2 1 2, instead of like normal kids start running both legs. This is where it will become as underdeveloped uh, in terms of running appropriately. Okay, and then sometimes you can see walking with the hunchback without a proper posture. So this one can affect a lot of things. Maybe when sitting, the child feel tired, so they don't want to sit. Okay, and parents like, please sit down. Why you can't sit? Or at the school, teachers like complaining why this child is not sitting properly, why moving around, standing up. So it has to be like, it can be one of the reasons why the sitting posture is not correct, the standing posture is not correct. So it creates uncomfort feeling for the child. Okay, so here we can see that by introducing physiotherapy to adjust or to correct such posture in terms of sitting and walking, the child improve, less pain on the leg, and then the child able to sit much longer. Okay, and some of the child with physical disabilities or physical difficulties, like children with cerebral palsy. Some of them have difficulty walking, and they are not wheelchair bound. They still can walk with assistance like a walker, but sometimes they get very tired of walking. So this is where physiotherapists will come in and help the child in terms of how do we activate the bigger muscle so they can support the body. So that's physiotherapist. Also, if you're looking for a physiotherapy, please check the background of the person, because normally physiotherapy, as the name, it's straightforward. It has to be carried out by a physiotherapist.
Okay, so Mr. Charlie, can I just ask, what is the difference? You say there's a lot of similarities between occupational therapy and physiotherapy, but what do they do different? Like, how would I know who do I go to for a specific thing?
Okay, so that's a very good question. So, like I said, normally things to do with fine motor, to be specific in terms of very fine motor, like pre-writing skills. Okay, this one is where you go for occupational therapy. Something to do with sensory, your vision, your taste, your touch, your hearing. This is where you go for the occupational therapy. For something like standing posture, leg posture, walking posture, body posture, walking, jumping, running, all this big activity, it will be physiotherapist. You can see it really depends on the types of uh, difficulty the child's having. For example, children with muscular difficulty, or like for example muscle dystrophy, where they have a weak muscle. So this is where you go for physiotherapist. Okay, and then because they will do some exercise activity to strengthen the core muscle for the kids to maybe stand again, or to perhaps maybe can walk again to support the body weight. Yeah.
Thank you. Okay. So other than that, what other interventions do you have, since you said there's around 7 or 8?
Yep. So the following one will be, it's quite obvious, speech and language therapy. Okay, this is, I believe, parents out there or any teachers working with children with special needs, you can hear this a lot. They call speech therapy, speech therapy, speech therapy. They basically focus on speech. Okay, but that's not only that. Okay, speech and language therapy is just a therapy carried out by speech language therapists, or they also known as speech language pathologists. Okay, so these therapists, they focus on speech difficulty, language difficulty, as well as swallowing difficulty. Okay, the third part is something that is not common. Okay, a lot of people thought that, oh, my child has speech difficulty, I just send to speech therapist. But actually, when a speech therapy provide therapy, they also check if the child has language difficulty. Okay, to keep it simple, speech, from my understanding, because I'm still learning as well from a speech therapist. So a speech basically the can the child make a sound, vocalization. Okay, language is how the kid makes sense of or how to produce certain types of words, sentences. Okay, that's why they have a pre-language skills. Okay, it seems like almost the same thing like the term is you can find this kind of term in OT or visual as well, pre-writing skill, pre-walking skill, or pre-something. So for speech and language therapy, they will assess your child to see if your child has speech difficulty, language difficulty. Sometimes the child might have difficulty eating or swallowing. This is where you go for speech therapist as well. So they will check basically your mouth, oral, and to see if there's like a difficulty. So it's quite uh, straightforward, but at the same time, it can be quite confusing. Why? Because not only they don't only see speech difficulties. Speech therapists, they also focus on language difficulties. A child might have language difficulty, but not so much of a speech therapist. Okay, but in the layman term, in general, we all see it as one, which is speech difficulty. Okay, so this is where for like special needs teacher, they do have milestone as well. For example, teachers will see if your child is ready for school. They look at school readiness. Okay, in terms of can your child follow instructions? Can your child do recognize what I call this alphabet numbers? Okay, same goes to OT. Okay, is your child ready to have the necessary skills needed for like fine motor for writing? For visual as well, is your child at this age able to walk? So same goes to speech and language therapy. Okay, at certain age, they will assess if your child is able to make a sound like baby 16 months, 12 months, they will be babbling yap 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 or making sound, and then from there they will start to move on. So each therapist, they have their own milestone. So then based on that milestone, if there's a gap, then this is where speech therapists will provide the intervention depending on the child. Is it because of language skills difficulty, or is it because of speech? Okay, so this is where they will do a thorough assessment. So these are the intervention provided by the speech and language pathologist. Okay, and then it's pretty straightforward. Those who carry out this kind of intervention, they are known as a speech language pathologist or speech language therapist. So if people that are looking for such intervention, only this type of health professionals are providing such therapy.
So, how can they, how will the parents know, or how will we know when the child is delayed, like in their speech or in their language? How will we know?
That's a very good question. So for those who join our Facebook Live today, if you have any question, feel free to post in the comment. I'll try my best to answer as many as possible. So that's a very good question. A lot of parents ask me that as well. So that's why when we talk about intervention, I always start with diagnosis. Okay, if you see a doctor, doctors also have their own milestone, especially pediatrician. So when they work with a child with certain age, there's certain skills that or requirement that has to be met. If the child didn't meet this kind of requirement, then they will suspect that there's a gap or possibly a delay. So when the doctor do some assessment, same goes to clinical psychologists. So when they check the developmental milestone of the child, then they see that, communication-wise, when I call him or I give certain questions or I ask certain things, the child might have difficulty following my instruction. Then they might be possibly, they might recommend that this child, in terms of communicating, we might want to refer to a specialist, which is a speech language therapist. So this is how they can detect by looking at the overall development. They will break it into small parts or fine motor skill, or we send to OT. Gross motor skill, big motor movement, we send to physiotherapist. And then when come to communication, or this child have difficulty communicating or making sound, or unable to give me, let's say a 7-year-old child, they can maybe can speak supposedly able to form a sentence, okay, like maybe 5 words in a sentence, but this particular child unable to do so. So this is where the doctor or the clinical psychologist will say, okay, this child is 7, but unable to give, unable to form a full sentence, and maybe the word jumbled up, like water I want instead of I want water, or give water. So it's not a very proper sentence, given that this child is already 7 years old. So this is where the doctor or the clinical psychologist will send to speech language therapist to further assess the child if he or she has speech or language difficulty. Then from there they will do an assessment, and then they will let you know what kind of where shall we go from here.
But just say if a child can speak, can form a sentence, but it's based on whether or not he wants to answer or she wants to answer. Is it something that parents should be worried about?
Okay, so this is the thing that I also often encounter with. So when is a problem? Okay, so this is really I would say rule of thumb. We can't I can't really tell you when is it a problem, but if something is worrying you, for example, the child choose to not to talk most of the time, but suddenly out of nowhere start to blurt out. If you are concerned about this, then you can seek for professional help. Also, one of the rule of thumb I would say is, let's say your child is 5, but only speak 1 or 2 words in a day. So this is where I think you should send your child for an assessment. Okay, it's really rule of thumb because parents know the child the most. So, so this is where it really depends on the parents to see if it's a concern. Some might say that my child doesn't talk, so am I. When I was young, I don't speak until I'm 7 years old. So it's really hard to put a gauge. So for me, it's always I will ask the parents like, okay, if this is your concern, let's speak to the one that really know what's going on. So from there, they can know whether your child choose to speak or they really don't know how to speak. Okay, because we wouldn't know unless we see a specialist.
Wow, that's very interesting. Okay, other than that, Mr. Charlie, what else, what kind of intervention do you have?
Okay, so after speech and language therapy, this the next big intervention that is quite well known among children with special needs is behavior therapy. So this is quite a big thing. So it's pretty straightforward. Behavior therapy. Okay, and currently the one that has a big name in terms of Malaysian setting is ABA therapy. Okay, so ABA therapy are quite famously known for uh, providing behavior intervention for children with autism. But over the years, A lot of children, regardless the type of uh, special needs that they have or difficulties that they have, as long as it's related to behavior, then if they will turn to see a behavior therapist. So a behavior therapy will be carried out by a behavior therapist. So at the moment in Malaysia, it's not like a speech clinical psychologist where you need to be a member of an association for you to practice. Same goes to occupational therapists, physiotherapists, speech and language therapists, where you have to be registered in order to practice. But at the moment, behavior therapists are not so much. A lot of parents ask me, how do I know if the person is qualified and things like that. So for me, it's basically talk to the behavior therapist first to know what kind of therapy they provide. So basically, behavior therapists, they deal with a lot of behavior. This is the general one. But to be specific, they do address uh, children with communication difficulties as well. Okay, because some child they will communicate through behavior. Okay, for example, a child wants something, but maybe they don't know how to request. So they will use gesture, pointing, okay, or when the child is angry, they don't know how to express. So they start throwing things. Okay, so this is where a behavior therapist will come in and try to understand the situation. What is going on? Okay, they normally use the ABC chart. Antecedent is before, behavior, and consequences. So basically, this is a very general observation they will do. Okay, they want to see what is the trigger that caused this behavior and what is the consequences. Why consequences? Because the consequences will determine the behavior. So if, for example, if the child throw things, if the child wants something or angry, that's antecedent, and behavior, they start throwing things. And then consequences is the child get attention from the parents. And if the child feel good about it, this behavior is more likely to repeat again. Okay, because they get what they want by showing this kind of behavior. Uh, so this is where behavior therapists will come in and help. And nowadays it's quite a big thing because it's applicable at school, center, home. Behavior therapists will go in and start modifying the behavior. Okay, uh, to be socially appropriate, to be classroom appropriate, to be home. Parents were like, my child is not compliant, my child is not following my instruction, start crying, throwing things, hitting. So these all the things that we can see is behavior. Okay, so behavior therapists also they work around emotion. Okay, so just like speech therapists, when we talk about speech therapists, a lot of people say, oh, speech difficulty, I go speech, but actually they do language difficulties as well, swallowing. Okay, difficulties. Same goes with behavior. They deal with communication, they deal with behavior, and they deal with emotional as well. So a child might have difficulty regulating emotion. Okay, they cannot process this feeling like why is it because I'm angry or I'm sad they cannot express so the behavior come out they're unable to process this kind of emotion. You can mostly, I mean, the common one we can see in children with autism, children with ADHD, we have children with emotional, social emotional difficulties, okay, where they are unable to regulate like any other people. So the behavior tends to be exaggerated, okay, like throwing things, head banging, I throw myself on the floor, okay, I flip the table, okay, I punch my friend, okay, these are all the behavior you can observe. So this is where behavior therapists will come in and introduce in behavior therapy on like how do we manage this kind of situation.
Um, One question just came to my mind, Charlie. What about children that struggle with reading and all of that? Like, who do they look for? Is it behavior therapy also?
Okay, that's a very good question. Recently, I think 2, 3 years ago, we started to have therapy. We deal with reading, so which is called a reading therapy. Okay, so reading therapy is basically to help children with difficulties in reading. Uh, and it was quite famous in the Western country, not for children with special needs. Okay, this one because child maybe the child has literacy problem, but the teacher might recognize that, oh, this child has literacy, unable to recognize words, but doesn't have any, do not have any known special needs or difficulties. Then this is where a type of reading technique is introduced to help the child to pick up. But when it was introduced around the world, some way, somehow, it does help children with difficulty. For example, specific learning difficulties or specific learning disorder, like dyslexia. Okay, when they see the words upside down or mirroring, B and D is mirrored, 6 and 9 is mirrored, uh, E and 3, capital E and 3 is mirrored, you know. This is where I wouldn't say accidentally, but somewhere, somehow, it's just able to address such difficulty. So this is where we, in my story here, we provide reading therapy for those who have difficulty in reading. So regardless the child um, have difficulty like disability or difficulty or special needs, as long as they have difficulty in reading or recognizing the words, okay? Because in my opinion, learning difficulties are still quite new. Okay, why I would say that is because if you remove learning from the child in terms of academic, then you won't see this kind of difficulties. So you have to put the child have to go through certain type of learning in terms of academic. Hence, the name of specific learning disorder come out. It has to be in a setting where the child is learning the most well-known is academic setting. Okay, where you introduce numbers, you have introduced alphabet, the child have difficulties. So this is something that is quite unique. Okay, so and it happens that reading therapy, which is another type of intervention that can help children who have difficulty reading. Like for example, as simple as CAT, cat. A child can, those who have difficulty, they are unable to, they can or maybe can read when it's individually, like C, A, T. But when you put it together, we normally will say as cat, but a child might have difficulty, like what is that? So they maybe they cannot read the sound or they cannot recognize. Or a child might recognize the sound. I can tell you, teacher, that's a cat. But if you ask them to spell, they'll be like TAC, TON. They will, you know, this is where they are unable to recognize or spell the words out. Or you can see some kids. This is something that I encountered personally because they are so used to read the same book. Okay, when we happen to change the words inside, they just read it like how they used to hear, but without realizing that the words inside change really. For example, I like to eat ice cream. Okay, every Saturday I will go buy ice cream with my mommy. We change the word mommy to daddy, so they will read the same thing as well. They will read it as I like to eat ice cream. Every Sunday I go buy with mommy, but without knowing that the mommy, that word we remove to daddy. So this is where a child might need reading therapy to improve in terms of reading, recognizing sound or words. You know, just like any other therapy, reading therapists also will assess uh, the sound. It's a child aware of the alphabets, the sound that they make. You know, when you mix a word together, there's a sound and things like that. So this is where they can know at what level or which literacy level your child is. So it's very similar like how a teacher teach language, but this is more specific. Okay, classroom teacher, they will teach different kind of subject. But when we talk about specifically on English, uh, they are very into reading. Uh, they focus very much on that more than what an English teacher would do, but specifically on reading.
I see. So, like you said just now, right, Charlie, that they tend to mirror the things that they see, like E
Hmm.
and P and Q.
Hmm.
So, when the reading therapy comes in, how can they contribute to the child? Like, is it possible for the child to start seeing it as, like, reading it as just P and Q in after a few sessions or something like that?
Okay, this I'm not very sure because I'm not a reading therapist, but I've seen therapists that yes, after a while practicing, they are able to recognize certain alphabets, how it's supposed to be. Some of them very unique because in reading therapy they do teach about the sound. So maybe they write P the P or Q the K sound. So by listening to that, when you said they will then that's Q. So it's very unique. I can't really describe uh, how is it be, but this is when I observe reading therapy therapists, they work with children, especially dyslexia, because specific learning disorder or SLD, the one of the most common one we know is dyslexia lah. So we have I happen to see this child working with the reading therapist. So by practicing the sound, the child is able to recognize the alphabet. At first, they couldn't because they get mixed up. But after practicing, like, oh, you say the sound first before you write. So this is where they can differentiate. The P is P sound, the Q is K sound, something like that.
Yeah,
So it's really unique. I can't really describe what technique they use, but this is how one of the technique that they help the child to differentiate P and Q, okay, or the E and three. You know, E is the sound, maybe it's E. Three, you need like the few alphabet inside to be three. So they a lot of practicing needed and working with the child. Then this is what they can differentiate.
okay, that was very interesting. I never knew. I always thought that, oh, so how, I always wondered how are they supposed to start reading it like properly if they couldn't recognize it in the first place. So now that's very interesting.
Correct, correct. Because some kids I know, they're very good in talking, but when you give a piece of paper, they can't read.
Yeah, that's true.
So this is where reading therapy will come in. Like a reading therapist will come in and work with them. Like, what exactly going on? Okay, like for example, apraxia, something that found in speech and language therapy. A child can read, I don't know if they understand, but this is something that I've seen also, which is quite interesting. They're able to read, but when you ask them, they can't say it in word. They can't put it in a sentence to explain what's going on. But when you ask them to, like Peter and Jane, Volume 3, they can read the whole book. But when the speech and therapist ask them, so can you tell me about the story? They can tell you by words. They cannot tell you in full sentence. So it's something that is almost similar like reading therapies, what I've seen. A child can, wow, they can tell you like, storytelling very fluently. But if you bring out a book, then they'll be like, they struggle. They can't even read the whole sentences. So this is where a reading therapist will come in and see what actually is going on. You can speak, Okay, it's because it's really unique. How do you speak when you cannot recognize the words? So, so yeah, sometimes you do see some of the therapists, they work hand in hand to address some difficulties. Okay, yeah.
Okay, so other than that, is there any other interventions or training?
Okay, the last one will be intervention, but also doesn't look like an intervention. It's something that I myself is doing to provide counseling for parents. Why I say it is a counseling, but sometimes it's not. It's it's a because when we talk about counseling, it's a lot about talk therapy. Okay, a lot of people may seem that they don't need it because the word counseling is associated with mental health. Yes, it is true. Okay, in my point of view, children with special needs, especially those with emotional and behavioral, they are fall under mental health. Okay, so this is where a counselor will come in. Okay, but most of the time we work closely with parents. Why I say this is because from my experience, I speak on behalf of myself as a counselor. Most of the child that I meet, they are unable to talk, okay, or they are unable to express adequately or at least at their level. So then it's very hard for a child to have therapy or a counseling session with a counselor. So that's why from my experience, we do work closely with parents. Uh, it may seem like it's not necessary, but actually it is. Why? Because as a counselor, not only we provide counseling, but we provide guidance. Okay, guidance is very important in terms of planning what to do, where to go. Okay, a counselor are trained in terms of providing a guidance or providing not solution, but suggesting things for parents like what are your priorities. Okay, after finding a doctor's, uh, when you go see a counselor, they'll talk to you like, because uh, in order for parents to see counselor, from my experience, they always come in a state of incongruent or in a state of not feeling comfortable. Okay, they feel stress, difficulty in accepting reality, difficulty in accepting the fact that the child has difficulty. Uh, they couldn't believe that uh, this kind of thing happened to them. So they are when they come and see me, they are already in a state of distress. Okay, so how we're gonna release this distress is we work closely as a counselor. We work closely with parents to lay out what are or what is your difficulty, and then we start working on it. So this is where guidance is all about. Okay, it's still quite new. I wouldn't say new, it's been here since the 90s. It's just that in terms of special needs, it will be uh, helpful to have a counselor come in to work with other therapists, especially like you can see this like counselor and clinical psychologists. We work closely in hospital settings when we talk about depression, anxiety, uh, we talk about GAD, general anxiety disorder. We talk about OCD. We talk about schizophrenia, psychotic episode, among teenagers, stress, the basic one. Okay, we work very closely with clinical psychologists. Why? Clinical psychologists will do an assessment saying that this teenager or child has uh, dysfunctional belief or the belief system is somewhat not working appropriately. So they tend to have negative thoughts. So this is where counseling uh, will come in and provide a counseling or a talk therapy to help the child or the teenager. Okay, but when come to children with special needs, normally a counselor from my experience, working with family definitely is something that will be very good for the parents, because counselors are trained to gather information, and then they track and follow up, you know, how's your um, um, like how's your current situation? Do you feel much relief? And then also we provide parents on like stress management, okay, prioritize planning, okay, how can we reduce? We take one step at a time. You know, there's a lot of techniques in counseling that we can help parents with. Okay, why I emphasize so much on parents, because you work together as a team. Okay, we cannot have father decide to have this therapy, mom said that, and then this is where they will clash. So when they clash, the child are unable to receive the appropriate. For example, parents bring the child to see a doctor. Doctor said you might want to see OT and speech. Then the father would think, I think OT is more important. I send for OT. The mom disagreed, say that no, I think speech is more important. I send to speech. In the end of the day, if they couldn't agree, the child will not receive anything.
Yeah.
Because they're still in the process of deciding what should I do and what. So this is where I always talk about family dynamics disrupted. Okay, the family become somewhat unable to function for a while because of disagreement. But in terms of family counseling, I personally do not agree or will not suggest to postpone everything just because of a disagreement. Okay, we can lay out the disagreement and work something out, meet in between. Okay, so this one also we talk about expectations. Okay, when parents like uh, they have their own expectation, like for example, the child are still learning to write. Okay, but then my expectation for my child is to write an essay, 200 words, when my child just starting to write ABC. So this is where counseling will come in and let the parents know, your expectation is somewhat very high, which is realistically, it's not realistically unachievable. So this is where we have to work together with the parents and bring it down. So this is where um, I myself are having difficulty, because the counseling is something that is stigma. So for those who are looking for counseling services, definitely you have to look for someone who are registered. Okay, we have a body of governing body, which is called Lembaga Counselor Malaysia. So you can just put in like my name, you can go LKM, put in my name, Charlie Wong, and you can see for us, in order for us to practice, we have to stay registered every 2 years. So that's how you know if the person that providing counseling is somewhat qualified. So same goes to all the therapists that intervention that we talk about today. So yeah.
So, when it comes to counseling, right, Ms. Charlie, how do you, for those parents that are not open into meeting you, but you know for a fact it will take a toll on the child's progress and all of that, how do you tackle this kind of situation?
Like I said, we have to outline uh, their concern first. I always ask parents, what are your concerns? Okay, both of you disagree because of, then we work it out. Okay, and I always told parents that it husband or as a family, everyone have to play a part, because taking care of not children especially, taking care of a child is really hard. It's not easy. So if we talk about taking care of children with special needs, it's different level, definitely a higher stress. It's proven by research many years ago, and even now, especially now, after now we are in endemic, we can see a lot of parents are struggling, okay, to balance. So this is where I would say counseling will come in and, somewhat like a middleman. Okay, so what's the deal? We have to lay it out and work together as a team. How do we achieve the balance? Okay, a lot of techniques that we can apply. It really depends on, ultimately, it really depends on what the parents want. Okay, not the parent. We need both sides to talk about their concern, and then we can move on. Okay, this one we normally we will see this a lot, but like I said, uh, in our culture, we are not taught to like speak openly. Okay, so this is where, from my opinion, where there's a gap on intervention. Parents deciding for intervention and the child receiving intervention, and the gap is quite big. Okay, what I mean the gap is quite big is the process of getting intervention, the time is longer, so the gap is quite big. Okay, either the parents cannot decide, or because of stigma, there's a lot of things. So this is where we need all this kind of information or intervention. So for parents out there, so they can decide, or they can know who to talk to, or they can go meet a counselor. You know, caregiver stress is something that it's been going on for many years, but we hardly talk about in Malaysian setting. Caregiver, like teachers have stress, therapists have stress. They all have, because providing this kind of services is not easy. But like I said, caregiver stress is something that is big. It's been over the years that a lot of mental health professional has been talking about, but in special needs community, the focus is so much on the child that parents sometimes they forget that they get tired as well. So this is where counselings are quite important.
So, thank you for sharing with us so many types of interventions, Mr. Charlie. So, out of everything that you have shared with us today,
Mhm.
can you just briefly give us a summary before we close up?
Okay, so if I'm not mistaken, I've already shared about, yeah, a type of intervention. So basically, if you're looking for diagnosis, you go for clinical psychologist. They will screen your child, and then basically they will meet your child first, and then they'll screen to determine the type of uh, disabilities or disorder, and then they will provide a suggestion. Who do you go to? And then when they said, who do you go to? That's where the next intervention come in. If you need academic support, if you have difficulty in terms of academic, you go for special need teacher. Okay, academic support. And then if your child have difficulty with fine motor, sensory, concentration, uh, yeah, that's where you go for occupational therapy. And then if your child has difficulty with big movement, gross motor, like unable to walk, unable to crawl, unable to run, this is where you go for physiotherapy, okay, or leg pain or certain pain area. So this is where you go for physiotherapy to address such difficulty. And then you go for speech and language therapies if your child have difficulty swallowing, speech difficulty, or language difficulty. Okay, and the next one, if your child has difficulty in terms of behavior, we can see a lot of behavior. You repeat yourself a lot of time, but the child still behave a certain way. This is where you go for behavior therapy. And then if your child has difficulty reading or literacy difficulty, this is where you go for reading therapy. And last but not least, is counseling. Again, normally uh, when you go through consultation, parents are looking for someone to talk to your difficulties. Definitely, I would recommend to go for counseling, for consultation and guidance. Yeah.
Okay. Wow, that's a lot to digest, but it's very interesting. So thank you so much, Mr. Charlie, for joining us today and sharing with us so much different types of intervention for
Yep.
children with special needs.
Yeah. You're welcome. And also for those parents that if you have any question that I cannot answer now, or if you wish to speak to me, you can check out our website at Mind Story. And I don't charge any, we don't charge any consultation fees. if you're looking for like someone to talk to, like you're not sure what type of therapy or difficulties your child might have, feel free to contact us. Okay, thank you everyone. Thank you, Alisa.
Thank you. Bye.
Bye bye.